Hello and good evening and good day to everyone. It's me again, Caroline, your host, and it's really nice to be back here after the weekend. And today we have a Monday, and I do hope you had a nice weekend, of course, and are ready to meet someone new. This is our new presenter, and you can see her right here. Hi, Laurie. This is Laurie Metz. How are you feeling, Laurie, today?
Hi, I'm feeling good, and thank you for having me today. This is a treat to be able to talk to the audience here
We are
with you.
definitely happy to have you here with us. And let me just mention that Laurie has brought to you quite interesting topic. As you can see, it's mind, body, and soul connection through your fertility journey. So she will start with her presentation on that topic. And of course, as always, she will also answer your questions. So all you will need to do, just type those in the chat section, and after the presentation we will have that Q&A session, and Laurie will be happy to answer all of your questions. And let me just mention that Laurie is like a clinical social worker, but also certified case manager, therapist, author, and public speaker. So
Oh my goodness.
she's been in this for a very long time now, and she definitely knows what she's doing. So we are very, very excited to have you here, and we are connected tonight with New York. So also hello to New York. It's good to. I hope you had a good day so far as well, and I'm definitely happy that you have decided to join our Stronger Together initiative. And of course, you know that all those Stronger Together events have been brought to you thanks to our ambassadors and partners. And as always, I want to thank them for their support. And well, you can see all of them right here. And I'm not sure if you see, but actually, Laurie is one of our ambassadors and partners. So I would also like to thank you, Laurie, for supporting us from the very beginning of this Stronger Together edition. This is the second edition. So thank you so much for joining and for your support.
Oh, my
And
pleasure. I mean, the things that you're doing are so helpful to bring this information from all different areas and avenues of fertility to people from all over the world. I think is such a gift. So I'm glad to
and
be part of it. I had to put
and
my
we are
glasses on to see the pictures. I'm glad to be.
yes, you are right there, of course, in the middle. So thank you so much. And yes, we are definitely happy to be able to help you out as much as we can. As we know, those times are definitely strange and hard, but we will support you. And you know that there are more and more of those Stronger Together events coming up as well. And tonight, let's go ahead with the presentation that Laurie has prepared for all of us. So, Laurie, are you ready to start?
Well, thank you, and for everybody who's on, thank you so much. I know in the UK it's late, so we're going to have an interesting conversation after a full day's work. Whereas here in the US, it's not quite that late, but I think people probably are winding down from their day. I hope everybody's working so many different hours today, and we want to make sure that our mind and our body and soul are all being taken care of, whether on our fertility journey or not. So thank you for joining today. I'm going to take a look at your questions after I finish, as Carolyn said. So the mind-body connection, just to give you a little bit of background, it dates back to the 17th century. And that's important to know because what that means is we've been thinking about this for so many years in the world. And there's two schools of thought. One is that they are not related, and one is that they are related. Now, I personally believe that they're related. And it's important to kind of understand what you're thinking with that at any junction or moment in time, especially on a fertility journey. So there's a quote that I just thought I'd put in here now, and it says, I certainly believe that being in contact with one's spirit and nurturing one's spirit is as important as nurturing one's body and mind. We're three-dimensional beings, body, mind, and spirit. So an unexpected journey, one that we thought was not going to be the way it was, can impact all areas of our life, and especially during COVID-19. I don't know who's out there listening really, but I like to frame things with giving some information. So in terms of fertility journeys, I don't know if very many of you know this, but it is scaled as significant equally to breast cancer, death of a family member, or a divorce. It's high levels of distress and actually mirror those conditions. for people going through fertility journeys. It's said actually that, and I found that this is such an interesting statistic to share, that over 50% of women and over 30% of men experience depression during this time, and 76% of women and 60% of men in treatment express anxiety. So what does that mean? What do we know and why? Well, overall, and some of you may know all of this, and these statistics are based in the US from the CDC, 13.1% of women of fertility bearing ages have used infertility services, and almost 13%, 12.7% of women have accessed fertility services. That's approximately 1 in 8. So when we think about that, 9% of people accessing treatment is a really large number. Approximately a third is attributed to the female factor, a third the male factor, and that third category of unexplained, where they're just not sure, is the one that kind of keeps us up the most at night, because not knowing leads to so many other questions. And so as we're on our fertility journey, all of a sudden we learn that we have a diagnosis of infertility. Now, for some people, having a diagnosis is very helpful because now you know it's a condition. But it takes so much of us. There's so many options that now we have to consider, and questions and decisions. And for a lot of people, it's just a constant preoccupation. So it almost takes a physical and emotional toll and can be absolutely exhausting. It feels like there's a huge weight on your shoulder, and for many, it is a huge weight on your shoulder. So I'd like to define a few words that I think are very helpful in trying to care for ourselves during this process. They're thoughts and feelings, and separating the two. And those who I've worked with know that this is a big thing of mine to talk about. It's nurturing yourself, pampering yourself, and caring for yourself, and what those differences are. So our thoughts are our ideas, they're arrangements, and they result from thinking is a plan. It's an opinion and a picture. It's a way of moving forward, and usually it involves action. Our feelings is an emotional state. It's typically evoked from a thought or from a situation or an event. And if we ever have a hard time identifying our emotions, we can look at our emojis on the phone, but I'm going to go into emotions quite a bit in a minute. Then we talk about nurturing, pampering, and caring. We could think that some of them are very similar, but they're different, and understanding distinctions in words is very important. So nurturing is to support yourself. It's to develop and cultivate and encourage. Pampering is to treat yourself and gratify yourself with excessive indulgence or kindness. So I like to use the analogy of getting a manicure. So sometimes, you see something and you're so sad and you're depressed and you're going through a lot, and thought of getting a manicure has been on your mind, but you haven't been able to juggle it in, and you go. And that can actually be nurturing. But at other times, maybe you go a couple times a week and then your polish chips and then you just run in. Well, that's pampering. And so whether there's men or women on the phone, I'm sure you can all understand this analogy. But now we're going to bring in another one, and that's caring. So caring really relates to kindness. It relates to affection and, making provisions to be helpful in a kind and loving manner. Think about that. Think about how you're caring and kind and nurturing to yourself and pampering. When you're going through this journey, sometimes you feel like your thoughts and your feelings aren't corresponding to each other. You have to say to yourself, are they impacting my body? Are they impacting my fertility journey? It can feel like a roller coaster. You're constantly rushing to wait and rushing to wait, and your feelings are going in so many different directions. People are talking to you about things and you don't understand, one of the words, and you're sitting there with the doctor and you get caught up in that word. You can't hear everything else. And then your feelings are impacting this whole journey. So you try and keep all the information in, and you try and keep moving forward because you want to have your baby, you want to have your family. But recognizing the feelings is essential, because then we can tune into them and understand them. So we can be experiencing things and feeling things that we never thought we would. We could have fear and anxiety and self-blame and sadness and depression. We could feel jealous. We could feel guilt, helplessness, shame. We could be embarrassed at times of our feelings. but let's recognize them. And that's really recognize that the feeling that truly recognizes, that truly resonates during this is hope. So I included this other emotions wheel because I think it's really important to be able to define and pinpoint words and emotions and feelings. So you can Google these, they're readily available. But experiencing these feelings, allowing yourself to acknowledge that they're all normal. If we go back to realizing that fertility journeys could be equivalent to a chronic condition or even a condition that maybe causes death or is terminal in terms of emotions, then we recognize that we have to understand that what we're feeling is normal. But there is always hope here. And that's what we want to keep in mind. So, this is a little exercise to consider. Have you ever contemplated a situation in order to understand its components? Made a decision based on facts, but feel sad or upset about that decision? If you can you think about the situation and define it? Just take a minute. If you're having a problem thinking of one, I will suggest that you think about a fertility journey. Like, what are your thoughts? Your thoughts are that you want to have your baby and you're going to go through treatment. But what are the feelings? The feelings could be being scared or anxious or sad or down or depressed. And what's the impact on your body? It's a good exercise to kind of keep in mind because we want to tune into our body. I'm going to give you a quick exercise that I tend to give people at times. If you make a fist, make a really, really, really tight fist and look at it. Look at your hand. Look at the tension. Look at the color, and then release it. And look at the difference in your hand. Now I know from my hand, I see a difference in the color. I see a difference in the tightness. And what I'm seeing is blood flow. I'm seeing that when I'm tense and I'm stressed, the blood does not flow the same way as when I'm more relaxed. It's something to think in mind as we go through this. We want to draw on our inner strength, and seeing your future helps you to keep positive, understanding how to nurture and care for yourself. It's such an important part of your fertility journey. And of course, as always, small changes are the first step in caring for yourself. The mind body connection activity is what can help. So, breathing in, deep breathing, meditation, exercising, these are all things that require mind body connection. They keep our mind busy and our body at the same time. And that kind of lifts us. So now you're dreaming of having your baby. It's something that you always thought you would do, and you run into challenges. Oops, I think I missed a slide. You run into challenges. We get started, we get excited, that excitement kind of builds, and you go from contracepting, and for those of you who have used contraceptives, to trying to conceive. And you notice that the time is passing, and that innocent joy of trying to conceive begins to create some anxiety. And then you may experience miscarriage, so that miscarriage is not uncommon. It's actually quite common. It's been reported in some studies that up to 70% of pregnancies can result in miscarriage because so often people conceive very, very early on and just think their period is late. And when they were first coming out with pregnancy tests, home pregnancy tests, they almost didn't put it on the market because they were afraid that so many people would get discouraged in their pregnancy journey. But then as you're going along, it can take a little longer and the time passes. And so you decide to make that call to your doctor, right? And what is the impact of making that call? Identifying and understanding that your feelings are important and understanding the impact on your body, it helps you to take that action. So how do we find comfort in our decisions? Now, all of a sudden, we're told to go to a reproductive endocrinologist. Honestly, so many people have said to me, I didn't even know what a reproductive endocrinologist was. I'd never heard of it before this started. And then, not only have you not heard of the specialty, for those who haven't, you have to figure out which one to go to. Who do you talk to? And how do you really identify that? And then once you get there, understanding what they're saying. We want to be able to empower ourselves and advocate for ourselves during this process. And through that, we need to learn what it is that we feel secure enough to advocate for. and how we empower ourselves by doing that. A fertility journey is a time to nurture your mind body. After all, your body hears everything that your mind says. Naomi Judd, a American singer and songwriter, had that quote, and I always love that quote. There's a couple of things we learn as we begin. We learn that everybody has their own unique path. As we get older, it becomes harder to conceive. We're born with a certain amount of eggs, and that word geriatric, oh my God, it's awful, really awful. And our eggs, they get older as we get older. So do any of these things sound familiar, or can you relate to any of them? I'm thinking you can. What's the good part of this? That in 2020 and beyond, we have so many family building options. Biopsychosocial connection is a term that I learned in graduate school a long time ago. We're all three-dimensional, and what impacts one part of us impacts all. So I threw out a couple of things down at the bottom to just consider. Our relationships are so important. Our finances. This is an expensive proposition for many people to try and go through a fertility journey. The emotional health, physical health, social media, if you look at Twitter or Facebook or Instagram or whatever it is that you're using, and your support system. And most importantly, for those who have a partner, your relationship with your partner. So understanding the experience of the impact of your experiences are having on your mind and body is, I don't know, you can fill in your own word. I think it's essential or crucial. I have my little egg up there that's so stressed with everything on their mind that they're about to crack. Caring and nurturing and advocating for yourself. We all do this in our own ways. So we want to take stock in how we think and how we do this. A couple of questions you can consider or ponder are your relationships being impacted by your fertility journey? Am I communicating what I need? Do I get annoyed with what others say? Am I limiting my interactions? Am I feeling isolated and alone? Do I know how to care for myself? Now, this list goes on and on. What's important is you know what's on your list and the questions that you want to ask. So as your journey continues, the questions now are, how do you stay positive and empower yourself? How do you get strength? Who gives you support? And how do you find comfort in these big decisions that you're making? Because each one feels bigger than the next. Well, there's a couple practices. One is mindfulness. I'm not sure if you've heard of it. On a very high level, I'm just going to give you some of the fundamentals. Have you considered it? That would be really my first question. Have you considered trying it? And have you asked yourself if it'll help you? Will it slow down my mind and my thoughts? Well, what mindfulness is really an awareness, and it arises through paying attention on purpose and being in the present. It's self-regulating your attention and doing it with an attitude of curiosity and openness and acceptance. It's kind of like when you look at a child and they're curious about something they pick up on the street or they see, or an adult who's just kind of wandering. That curiosity in life, as you investigate it and you look at things as if they're three-dimensional, and you want to look at all of the different sides and understand it. It's not medication, it's an awareness. It's taking in and being in the moment. So consider trying this. Consider the cultivation of awareness. It is a common side effect, and that's relaxation. You cannot force yourself to relax, but you can try and be in the moment. You can try and consider what's in your mind. Is it transient because passing through? Is it curiosity and self-regulation? Can you catch yourself when you go on autopilot? As you notice these things, you'll be able to slow down. We don't want to necessarily stop negative thoughts. We want to recognize them for what they are and then know how to take the next step with how to manage them. Another thing we can consider is nurturing. So what does that really mean to you? I know I gave you these definitions, but what does it mean to you? Do you practice self-care, self-nurturing? Do you find harmony in these practices? So these are some of the questions you can consider when you're looking at this. What did you do prior to your fertility journey versus now to nurture yourself? Who is your support system and who currently gives you strength? What typically makes you happy or makes you smile and what brings you down? What's changed since trying to conceive? I know these can be loaded questions, but trying to look at them and trying to answer them can be very helpful. Allow yourself to address self care head on. Tune into your body, acknowledge your needs. You could do this through exercising or cooking or painting, whatever it is that gives you that activity of both. Because if we keep our mind busy and if we keep our body busy, then we're focused. And that's what you want is kind of focus things. We could start a gratitude journal or just take stock in what you're grateful for during the day or at night. Do something that makes you smile. The smiling itself releases endorphins. Do something that taps into the mind body connection. I'm sorry, I'm repeating that again. So, some of the things you may want to consider is box breathing. Box breathing is something that I really like very much. What it is I tend to give a 3 second breath. Some people give a four. You breathe in for 3 seconds, you hold it for 3 seconds, and you breathe out for maybe 3.5 seconds, or if it's four, then 4.5 seconds. The out breath is the cleansing breath. The other exercise is a smile breath. And what you're doing there is you're breathing in, and as you breathe in, creating a smile from ear to ear on your face and paying attention to how your body feels as you do that. And then slowly breathing out and releasing that smile and doing that twice. I can't really do that with you if we're not directly looking at each other, but you could try it yourself. And again, that's breathing in and creating a smile on your face from ear to ear as you breathe in, holding that smile, feeling the difference in your body as you release the smile and you release the air. Then there's another exercise called stop, which you can look up, and it's another quick relaxation technique. You could just pause, just hit the pause button for a minute. Ask yourself, why am I spinning? Why are things getting so stressful? What's really going on to gain that perspective? Consider your thoughts and how they correlate to how you're feeling. Fertility, it can seem cliche, but it's really powerful to embrace that you are not alone. Now, different countries talk about fertility treatments in different ways. What I think is universal is that some people don't talk about certain aspects of it because it may not be acceptable in your country. But for some people, it's very, very private. And there's the difference between privacy and secrecy. And so we want to understand that we're allowed to be private without feeling as if we're keeping a secret. So infertility, you're not alone. And what we really want to recognize is that once it's something that you're going through and you embrace the community, you feel so much support, especially during COVID-19, and especially as everybody is feeling isolated and alone. So I'd like to just end with this little quote or open up for questions with this quote from Ruth Bader Ginsburg, who was a Supreme Court Justice here in the United States. And she said that sometimes the biggest hurdles create the most special rewards. So often in life, the things that we regard as impediments turn out to be the greatest good fortune. And so I end with that, and I wish everybody here good fortune. And I'd appreciate if I could help you with any questions or if there's any just comments anybody wants to make about the journey that they're going through or about how they may be able to implement some of these things that I had just mentioned. I know there was a lot that we touched on.
You have just provided to us, and it's definitely helpful. And we are very, very happy that you are here with us for sure. Thank you so much, Laura. And of course, as you can see, there someone is typing, so I'm sure there will be more and more of those questions or comments coming up. But of course, let's take a look at the very first one that we have. It's not a question, actually, yeah. So perhaps if you can take a look and advise. Thank you
Uh-huh.
for this information. I'm struggling with infertility for the last 4 years. Tried IVF, which was failed. I spent a lot of money. I am so depressed right now. Don't know what to do. Want to try again, but just financial issues.
Yeah, it's so hard, and I understand, and this is something that so many people go through. I'm not sure what country you're in. There are some some fertility organizations that do give out grants to allow people to be able to afford their fertility journeys. In some states in the United States, legislation has changed. It's very depressing, I know. And the things that you could do really is to turn to your support system at that point, to look at what other, if any other family building options are available to you. And what I would really suggest consulting with a therapist if the depression is really too much and you find yourself crying all the time or quite a bit and too preoccupied. What you want to do is you want to just take stock in what you do have at the moment and try and look towards the future. And sometimes when you're in the midst of it, it's very hard to do without a third party. So I wish you a lot of luck, and please try and consider looking into some of these grants that are offered by some of the organizations.
And thank you so much, of course, for sharing. And we are definitely we are keeping fingers crossed for you, and we hope that you will feel a bit better very, very soon as well. All the best. Okay, and as you can see, Laurie, there are plenty of comments and questions coming up. Okay, so we do have another patient that has wrote, I am struggling with using the law of attraction. Feel like my negative mindset is stopping me from getting pregnant. Is there any time to this, or maybe I am overstressed myself and trying to be positive?
Well, I had mentioned quickly, it's very hard to force yourself to do something. So recognizing that that's how you're feeling, I think, is so important. Uh, you don't want to squelch a negative thought. You want to investigate a negative thought as to why it's there. So when I talk about curiosity and looking at things with curiosity, what I mean is really kind of examining it, taking it out of yourself and making believe it's a ball. And looking at that ball, or maybe an octagon is a better analogy, and looking at all the different sides and trying to understand the multifaceted part of it. It's very, very hard to be positive when you're going through an emotional and physical struggle that's also financial. I would suggest that you talk to people who you respect in the field. If that's your doctor, I don't know if you're happy with your reproductive endocrinologist, if you're going to your OB, or even if you have a family doctor who could give you some concrete information to help you that you feel supported by. Very often, the nurses in the office can be that point of contact. And I would encourage you to express your concerns and your fears so they can then just be discussed, because they're probably not different than other people have had. Uh, Being stressed is not a good thing. Does it impact fertility? I am not sure. I mean, some people would say yes, some people would say no. But I would say that taking some deep breaths, calming yourself, does help you. Some people turn to acupuncture, some people turn to nutrition. Um, it's finding that niche, but please try and reach out to people who are nearby, who are professional, that you respect, where you can actually ask your questions to. And don't be afraid to ask them. Very often I suggest to people they write down their questions before they go to their doctor's office. And don't be afraid to ask a question you think you should know, or a question that may make you sound as if you're a little too sad. It's nothing they haven't heard before, but they can't help you if they don't know that you're not experiencing it. So best of luck to you.
Indeed, as well. Thank you so much for that. And actually, there's one more, not a question really, but a comment. I feel the exact same as the previous lady has mentioned. I feel like I'm battling with the negative mindset, just like you said, of course.
It's so hard not to have these negative thoughts, because you're on these journeys for a while, and this is the beauty of support groups. I happen to love running support groups because women come together and they see they're not alone, and then they're able to kind of work through how to find these results. I mean, I worked with one woman recently. Not well, actually, I've been working with her for a while. She recently just had her second child through a donor egg, and she was one of the women who inspired the book I wrote. It's such a long, hard journey, and you never know how you're going to have your family. I think the point is just understanding whether or not your family has to be a certain way, and just opening yourself up to options. And very often we have a mindset where we're not opening ourselves up to options. And if there is support groups in your area, I would so encourage you to join them, because they'll allow you to see that all the thoughts that you're having are similar to others. And I'm not even hearing exactly what these thoughts are, except that they're negative mindset. And the negative mindset is that when you go through something and you get disappointed time and time again, it's hard not to, not to have that. But if you're continuing, then you know you have hope at the bottom of that. And that's powerful. That's very, very powerful. So thank you. I'm hoping that this is helpful, but please look into I don't know the websites, and I apologize for this. I don't know the resources in the UK. I know in America, Resolve.org is the website. The National Infertility Association here lists a tremendous amount of resources for support groups throughout the United States. I'm sure there's something very similar in the UK. I just don't know the name of it, so I apologize for that. But best
It's
of luck to you.
perfectly okay. Of course, thank you for that. And well, there is a thank you from Emma, and of course, again, wish you all the best, Emma, too.
Yes.
Okay, and well, there is there are more and more of those questions coming up. Okay, and it's regarding stress. So I guess we can go ahead to this one. So, how to deal with stress at work during the already stressful fertility
Oh, I
treatment?
know that could be so stressful, right? That is really hard. I have one person I'm working with, and she didn't tell her boss, especially with COVID, because there have so many people working from home. She didn't tell her boss until I think like 10 weeks before she was about to deliver. It's very stressful at work. The most important thing, I think, is your breath in many ways, and trying to remember to come back to it because it's something that's constantly with us. So knowing that you're stressed will allow you, I am hoping, to learn a way to take yourself out of the situation, even just for a minute. If you can remember, that's why I suggest 3-second breaths. If you can remember to try and breathe 3 seconds in, hold it for 3 seconds, and 3.5 seconds out, what that will do is it will calm. It'll bring your rates down, your respiratory rate, your heart rate down, and just the out breath is the cleansing breath. That is the breath that slows you. So if you're in the middle of a busy work day, if you can actually get this into practice, it can help. You also want, I think, to keep focus on what your priorities are. Some days they very well might be work because it's so stressful. And other days it's going to be the fertility treatment. So it's a matter of who you communicated to in your office that you're going through this, if you need to communicate to anybody at all, and trying to keep your perspective on what it is that you want. And I know that many women are primary support, primary in terms of the financial support in the home today. And that adds a lot of stress if the partner and the woman are not working, where the woman feels that she could take a day off. Sometimes it's secondary infertility. There's children at home that you have to juggle. You want to just be sure that you keep your work in focus, but also that you take those minutes and those moments to nurture yourself and care for yourself in whatever way you find. It could be for 15 minutes a day. It could be for a few minutes a day. It could be for an hour or so. But if you could get that in, that would be helpful. So if you could cook more with being in the present than on a mission to have to cook. If you can maybe take a few minutes extra in the shower, whatever it is that you find relaxing, if you could do that. If watching TV is your thing, then maybe watch a half an hour show if that will make you feel just a little calmer and take you out of your work mode. So I hope these things help.
And wonderful, thank you for that. And actually, there is one more from the very same patient actually. So if you can have a look, how to deal with stress knowing the fertility clock is ticking.
Yeah, well, that's hard. Um, I'm not sure how old you are. The fertility clock starts ticking the moment you're born, right? We're born with a certain amount of eggs, and that clock just starts going. So as we get older, we know that our eggs get a little bit, older too. But the important thing to remember is that once you turn 35 or 40, it's not like you're going like this and then like this. You're not. This is a slow progression. And if you're taking the steps that you can to try and get pregnant, then you're doing what you can do. And I think that's the best way of empowering yourself and acknowledging what you're doing if you can find comfort in the doctors that you're talking to, in the information that you're gathering, in the plan that you have for your fertility journey, well, then that to me is the most empowering way to deal with the stress. If you're feeling like you're not in control, then dealing with the stress, I think, becomes very challenging. So I'm hoping that that's a little help for you.
All right. Thank you. And of course, there's great thanks from the patient and from the previous one, in fact, as well.
Oh,
So
thank you.
thank you for that. All right, and let's have a look of course, there are more of those coming up. So, what would your best suggestion to approach frozen embryo transfer be?
Yeah, I think that right now the trend is towards frozen embryo transfer. Um, and so the treatment itself, or my approach to any of this, is empowering yourself. And I think maybe I should spend a minute just talking about that a little bit more, because I just touched on it a few times. The question is, how do you empower yourself? And we all do that differently. So for myself, if I go to the doctor and I'm anxious before that doctor's visit, I will write questions down, and I will make sure that I can write down, I don't know, 20 questions sometimes. And some of them I may know the answers to, but I get anxious or nervous, and so I have to ask the question again. That list helps me so that when I walk out, I have the answers that I'm looking for. It empowers me. I think that's very useful. I think having faith in the people that you go to. Now, nobody seems to ever have 100% faith in any of their fertility doctors. They like them a lot, they think they're doing great. But typically, people always have that little question, because they're going on a journey, and the journey we're not sure of the outcome of yet. So, if you're going to go down the road of a frozen embryo transfer, then I would really suggest that you have comfort in your thoughts. And if you don't, then find out where your kind of balance is. What part of that is making you uncomfortable? Is the scale too much on one side versus the other? And so look at that. If the scale is too much on the side of, I am too nervous and I just can't do it, well, then maybe you just need to take a step back and wait and reevaluate. Maybe you need to gain more information. Or maybe your emotions are getting ahead of you a little bit, where you're thinking to yourself, oh my goodness, what if this doesn't work, when you haven't tried this yet? So we want to kind of keep in sync with where we're at. So tapping into empowering yourself, understanding your thoughts and your feelings really help greatly in a situation like this. I hope this helps. And if you have another question to that, please type it in.
Oh, wonderful. Thank you again for that advice as well. And next one is right here. So how to deal with failures when we don't have support system? I am single. I prefer to keep the steps to myself because it's even harder when I share and then fail.
Yes, this is so true. And single women going on this journey alone is challenging. It's hard. You do want to have at least one support person, if at all possible. And if not, I would strongly recommend that you join a support group. There's support groups online now, and what the support groups that I've run, what I've found, which makes me so happy, is that the women keep in touch. Some of them keep in touch for years after. There's also organizations for single moms by choice or single women by choice, and that may be international, and they can also provide that support. Dealing with failures is hard, but keeping your eye on your big picture is where you want to be. So if you can keep in mind that you're doing this to create a family and to build your family, then that will help you, I think, to keep going. If you understand the reason for the failures, hopefully you're in a category where they have an answer. If you're not, then that becomes a little bit harder to kind of understand that unexplained category. But if you're in a category where they know the answer, then you know what you're working towards. If it's unexplained, well, then you'll be sent down a different path. Either way, please empower yourself with questions and understanding what it is. So if you get very upset, I want you to try and find a way to be caring to yourself and nurturing to yourself. So you begin to separate what you're really thinking about. And then those thoughts are what you need to communicate to the people that you're working with. You don't need to communicate them to your friends, but you do to the people that are helping you. So best of luck to you.
And once again, of course, I definitely join you with those best wishes. And
Yeah.
thank you also for sharing. And we do hope that it's going to be a bit better soon enough. And of course, thank you from the patient. Now we will go to the next question, a bit of a longer question. I find myself struggling with the thought of success after 12 IVF, as so many things went wrong in every step of the way. I've done a lot of homework. It's difficult to imagine this working out well. I know it's all out of our control, but how can I try to accept success without self fulfilling prophecies of negativity? I've done so much research and feel this clinic will be the best chance I've got so far.
Well, it's so hard, right? It's such a long journey, 12 IVFs, so many. And you've gone through so much doing this. So I understand the struggle emotionally, physically, and financially. And if you're quarantined, it becomes that much more isolating. The piece here, though, is that there is hope. It's just hard to tap into that hope. And I'm sorry if I sound like I'm repeating this a little bit, but the self-fulfilling prophecy, I don't know if I believe in that. I think what happens is we're not going down a self-fulfilling prophecy. What we're doing is we keep going, and the fact that we keep going, like that little brain with the legs, we keep going because we know that we may be able to find our family. Now, very often we don't know what that family is going to look like. That family can look just like us, or that family can be a donor egg, or a donor sperm, or a donor embryo. It could be in the countries that allow it surrogacy. It could be adoption. There's always a way to have that family. It's just identifying which way you're most comfortable with. And that's the piece that I'd like you to try and hold on to a little bit. And I do believe that you're holding on to it because you keep going. If you stopped, then maybe you would be doing your self-fulfilling prophecy, but you're not. You're continuing. So I kind of admire that so much. Not kind of, I do. I admire that. I just would like you to try and tap into it a little bit more. So best of luck to you, and try and think of these things in a different way.
And fingers crossed once again, of course. Thank you so much, Laurie, for your advice as well on that. And of course, Angela, thank you for um, sharing yours.
Yeah.
Next one, of course, there's a bit of a longer question as well. I have been on this journey for 2.5 years. In this time, I have had a natural ectopic pregnancy and then IVF treatment with faith implantation. The thing that makes my head spin is that there is so much conflicting information out there about what to do and don't do and what works best. This causes me anxiety that I may not be doing the right thing and feeling I have to do a lot of the research myself, which I feel stops me finding additional time to do a lot of the research myself, which I feel stops me, sorry, finding additional time to go other things to distress. Any suggestions?
Yes, I am thinking you're Googling. I don't know if you are or not, but I'm thinking that maybe you're going to the doctor, or talking to the nurse practitioner, and maybe getting online and starting to Google. I wish you were there to be able to say yes or no. But we could go down this rabbit hole. What does it say? I'm reading a lot of books on fertility. Okay, yes, well, thank you. So we can read a ton of books. We can look into a ton of different things. The Everybody's going to have their own opinion and their own approach. And there's so many clinics, so many fertility clinics, so many doctors. There are certain protocols. Now, there are some that are experimental. There are some that are a little bit more tried. I would encourage you to figure out who the best person for you in your life is to gain this information from, and to have that kind of a fluid conversation with them. we when we go through struggles, especially with any kind of medical condition, we're searching for all kinds of answers. And if we start to read books and we start to look online, we get the information, and it's that person's perspective, that person's study, that person's opinion, that person's experience. And what we really want to do is we want to find out how that correlates to you and your body and your journey. The way to do that best is to speak directly to the people that you trust. Now, I do believe in educating yourself, but at a certain point, you are educated. There's there's certain factors that are important, and I would encourage you, if you're going to read, that you make sure that what you're reading is from a very trusted and kind of well recognized author or organization. So the organization I tend to recommend is ASRM. I know there's a counterpart. I really apologize that I don't have all this information for the UK, but I know that there is a counterpart there. So it's the American Society of Reproductive Medicine. It's asrm.org. There you have experts from all over the world who provide information, and there is a patient portal there, and they should be able to help with specific information, general information and knowledge that they share. They also have podcasts there. I tend to, on my own podcast, only have people who are expert in the field talk, as opposed to people just give their opinions, because what you want is you want to impart information that has been pretty standard and well researched and versed. So please look into the authors that you're reading and try and understand where you find your own comfort.
Sorry, there is a follow up as I haven't explained fertility. It seems that there are no specific answers.
Okay, unexplained infertility is very hard, and typically, thank you. No, I appreciate you doing that. I'm sorry if I was running on too much with that answer. Unexplained infertility is a really hard category to look into, and usually, though, if you've gone to more than one clinic, and most people with unexplained infertility have gone to more than one doctor or one clinic, it's not uncommon, it's quite common. Usually, it is a hard thing to do because you initially go to your first doctor and you put your faith into that doctor. So, if you have unexplained infertility and you've gone to a couple of doctors, I would think and I would hope that they would be giving you other options with the unexplained infertility. So, they would generally be able to, I would hope, not knowing your situation, be able to give you different paths in which you can conceive or which you can go ahead and move forward in having your family. And I hope that that's helpful.
And thank you so much for this, and well, very thankful, helpful. Sorry, thank you. And of course, there is a thank you from our previous patient, from Angela, here as well.
Okay, thank you.
All right. For now at least, it seems that that might be our last question. But of course, if you have any left, go ahead and type those in. And this is right here. What is your suggestion for me? I'm going for my first IVF in December. What should be my mindset? How should I relax and connect with this journey?
Well, that's an interesting question, right? Because it's stressful. No matter how you look at it, it's stressful to go through the first time, because it's something that's very different. And I'm imagining that you've probably tried a couple of other things before you tried IVF. Uh, well, I think a good thing to do is to have faith in the process that you're going through, and to recognize that you're doing this out of love and out of a desire to create a family. And you've already made the decision to go down the path. Taking the medication is scary. The whole process is scary, but you're doing it to follow your heart and to follow your desire to have a family. And I think if you keep that in mind, then that helps with the relaxation. So try that. Try and keep perspective on why you're doing what you're doing, and I think that that can help. And try and be in the moment as opposed to 3 steps ahead of yourself. So best of luck. I hope it works out well.
All right, thank you so much. And well, there is a follow up. Okay, so let me just go straight to that. I tried natural cycle to create a family, and after 13 years, we decided to try IVF.
Oh, okay. Well, I wish you the best of luck. Really, 13 years is a long time to wait to try. And I'm not sure of your age or the quality of your eggs right now, but I'm hoping everything goes smoothly. I know that actually adds to the impact at this point of trying through the IVF. So I wish you a lot of well with it. Recognize though that you had a lot of strength in picking up the phone and calling the reproductive endocrinologist and going through this. So I applaud you. I really do, because you recognize that maybe you would benefit from a little bit of intervention to help you to conceive, and I hope it works.
Excellent. And of course, as always, fingers crossed for you as well. And there is a thank you, of course, coming up your way.
Yeah.
And we will be finishing slowly. However, someone is typing. So, as always, I just want to make sure that Laurie had answered all of your questions. So, let's give it
Okay.
a minute and see if there's another question or comment.
Yeah.
Um,
Ladies, I'd like to just, while you're typing, I'd like to just, or gentlemen, I'd like to just add something. We empower ourselves by doing things that make us feel strong. And so asking a question can take a lot of strength. Advocating for yourself can take a lot of strength. But if we don't speak up for ourselves, then how do we move ahead? Yeah, I'd like you to think about a time in your life when you have spoken up for yourself. And I'm sure you've all done this, whether it was when you were a little child and you asked for an ice cream cone, or whether it was for interviewing for a new job or asking for a promotion. We've all done that. But these time, the stakes seem so much more loaded, so to speak. I don't know if that's an American expression or now not. So let me put it another way. At this time when you're going through fertility, it seems so much more profound than these other times. Realize, though, that you're allowed to speak up for yourself and you're allowed to speak up for your journey, and no question is too small. Sometimes when we exercise and we see a lot of people on their fertility journeys right now, like doing the Peloton bikes or doing different kinds of challenges online physically. Well, that's empowering. Sometimes cooking a meal that we haven't cooked in a while that comes out delicious, that's empowering. Sometimes getting the job done right during a stressful day at work is applauded. Well, that's empowering. So think of all the times in your life when you've been empowered, and hold on to that and carry it through to your fertility journey. So I think she finished typing. Is that true?
Yes, thank you so much. And well, actually, this is a suggestion from Angela. So it's she said that of course she is able to get in touch with some of the patients if they are interested. So of course, as I've wrote in the chat section, you can email me and I'll be more than happy to connect you. So all you need to do is just send me an email and I'll be more than happy to simply provide you with some details. And yeah, I think it's important to get that support. And thank you so
Absolutely.
much for doing that. Thank you so much as well. Excellent. And well, Laurie, thank you so much. We will be finishing, but sorry, there is one more. I just missed that. So
No,
let
no,
me
no.
just go to this. Okay, here it is. I gave up running going through IVF after 5 failed attempts. I decided to go back to it to help with stress. Is this having a negative impact?
Well, that's a medical question that I can't answer. I wish I could, but I think that if you are a runner and you're in good shape, you can talk to your doctor. And I do not think that they would say no. Maybe they would at certain points in the treatment, but typically, what I've heard is that if you resume activity that you've always done, then it should be okay. If you're starting something new, then it shouldn't. But that is totally a medical question. The key here is that you recognize that you need to be able to get rid of your stress and to relax. And somebody who runs to get rid of stress, that means to me that they need to be physically active to get rid of stress. So I want you to think of other physical activities if the doctor tells you that you cannot run, that you can do, that will get your heartbeat up and get those endomorphins going and help you to kind of clear your mind. So please, I encourage you to talk to them and ask them about the running. And if not the running, what other types of physical things you can do that will get your heart rate up to that momentum. The best of luck.
Wonderful. Thank you so much, of course, for this. And I just want you to see And there are some thank yous coming up your way, Laurie, as well. Great advice from Emma. And well, love this session. Would love to hear more from you. So
Thank you.
thank you for this. And well, yeah, there are more thank yous coming up. So
Well,
there
thank
is.
you all for joining, and I hope this was helpful.
Thank you so much. And we are definitely happy to be. I hope that we are able to help you, even if just a little bit. And remember that if you would like to get in touch with Laurie, there is an option for you. You can email her, or you can simply go to the site. There is a contact button. And of course, I'm sure she'll be more than happy to help you out even more. So don't hesitate if you have anything that is on your mind and you would like to get some more details. Just go ahead and do it. And Laurie, thank you so much for joining us tonight.
Thank you.
That's been a brilliant session, and it's always great to have those topics here and people just like you to support all our patients. So thank you for that. And to everyone else, thank you for your questions, for your comments, for sharing. And well, this is like Stronger Together events after all. So you know that we are definitely stronger together. So thank you. Thank you so much for that. And Laurie, is there anything you would like to add before I let you
I'd
go?
like to wish everybody the best of luck on their journey, and just to remember to take time for yourselves if you can, and just best of luck, and thank you for the questions and for joining.
Wonderful. Thank you so much indeed. And as you know, it has been recorded, so you will have a chance to watch this once again on myivfancestors.com and also on our YouTube channel. It will be uploaded tomorrow. And of course, we will be back here tomorrow and day afterward. So I can only encourage you to sign up for all the coming up events as well. Laurie, it's been a huge pleasure to have you here, and thank you everyone for joining once more. And Laurie, have a good day, the rest of the day, and wherever you are, have a lovely day or evening. And I do hope to see you back here, all of you, and of course, Laurie, you too as well. Hope to be
Thank
able to
you.
have another webinar with you.
Thank you. Best of luck to everybody, and be well.
Thank you. Take care. Bye.